Good evening, everybody. This is A.L. Johnson with A.L. Johnson Life Insurance Agency. Ready to have a very, very good conversation. I'm going to wait for a few of you to come in, but as you come in, do us a favor, like, heart, and share this content with your network. It's a very important conversation that we're getting ready to have about mental health. Have two very important people that are going to have the conversation with me. And so really quickly, I want them to introduce themselves. First, I have Mrs. Nicole Garner with Wyandotte County Public Health Department. Can you just tell us who you are, your position, and what it is that you do?
Absolutely. So, thanks so much, AL, for having me on. Again, my name is Nicole Garner, and I am the Planning and Operations Division Manager for Wyandotte County Public Health Department. And I'm honored to be leading an initiative on declaring racism as a public health crisis.
Thank you. I appreciate that. And State Rep Michael Johnson, District 23 from Missouri, the sharpest man in the state house. How you doing this evening?
I'm doing good. Thank you for having me, Mr. Johnson. It's just a pleasure to be here with Mrs. Nicole Garner, and I'm just looking forward to the conversation that we're going to have today, this evening.
Boy.
Likewise, likewise. Well, I appreciate you guys taking your time. And for those of you that are tuning in, don't discount this conversation because it's extremely important. What I want you to think about is when it comes to our government officials, generally they only like to have conversations with mainstream media where the clips are edited. The questions are softball questions, so to speak. And so to have people here that are willing to have the tough conversations is extremely important. And so when it comes election time, I want you to remember who's able to, be here and have these conversations with you. Also, just like all of our live streams, they are interactive. And so if you have any type of comments or questions that you'd like to add to the conversation, feel free to do so in the comment section. We'll be sure to address those. And so starting off, we're talking about mental health. We're talking about mental health. And so what I want to do first off is share with you all a chart. This is called the Maslow's Hierarchy of Needs. It is by a psychologist named Abraham Maslow. And this is as old as 1943. And so this is widely accepted in the field of psychology as the base of needs that human beings need to really reach their highest self. And so at the bottom rung, we have psychological needs, air, water, food, shelter, sleep, clothing, the basics. And if you don't have that in order, you can't move to that next rung, which is a feeling of safety, personal security, employment, resources, money, health, property, etc. And then for us to move into love and belonging, esteem, and self-actualization, everything below it has to be intact. And the conversation that we want to have today highlights the fact that most people in marginalized communities or underserved communities are still working on the bottom two rungs. And so we can never reach a point where we have the self-esteem that we need to reach our highest selves. This next chart, this is called the epigenetic modulation chart. And I want you guys to follow me on this because when you consider Maslow's hierarchy and the things that we need to really just meet that bottom rung and that second layer, these are the things that hold us back. And so if you look at the top, diet, think about the food deserts in the inner city where there are miles before you have a grocery store that has healthy foods. And so when a person doesn't have the resources that they need for a vehicle and they're on the bus line, a lot of times they end up at your Family Dollar or your Dollar General, and they're getting, foods that are high in sugar, high in fat, et cetera, and it affects their health. Disease exposure. We saw during the COVID-19 crisis that the most hardest hit areas were our low income areas.
Yeah.
Toxic chemicals, drug abuse, financial status, which is huge. In the zip code 64130, about 70% of the people live at or below the poverty line. And so when you take all of these things into account, and we have sayings like, pull yourself up by your bootstraps, how can we do that when we're not in position to? And so that's the basis of our conversation. Mr. Johnson, I know that you have to go at 8. You got another interview. You're talking to people in the community, and we appreciate that. So I want to start off with you. When you see those two charts and what they all entail, what first comes to mind for you?
Uh, First of all, what comes to mind is that, pull it up right here, is that when you spoke on the Maslow's on the chart and those needs, you can basically sum it up like this: if you're secure, then you're stable. If you're stable, you're secure. So if you have stability, then you can have security. And I don't just mean security like bars on the windows. I mean the security of having uh, good health care, eating a good diet that consists of good uh, foods that are high in nutrients, as opposed to eating, like you stated, foods that would come from a Family Dollar, boxed foods that are processed and heavily processed, they won't do anything for our bodies at all, except send our minds into a fog, a sleeping type status, where we are woke, but we are walking around as if though we have no identity of self-worth. And this causes an issue that will continue just to grow rapidly, and it always has, to the point where if nothing is done about it, from a standpoint of each community getting rid of food deserts, each community making sure that we are aware of the mental health issues that we have and having things in place that will benefit us and take care of those people. For instance, we have to have more caseworkers and social workers that deal with mental health patients. We need more therapists, things of this nature. Everybody is that were in these positions, per se, were in the baby boomer field. And now that those people are retiring and phasing out of those careers, we need to make sure that we have people in place that can help us combat these situations that we're facing every day.
Thank you. I appreciate that. For those of you that are watching and currently tuning in, I need you to do me a favor, like or heart this conversation, and also share it with your network. This is streaming on Facebook as well as LinkedIn and YouTube. And so we have 3 different audiences that are watching us right now. Mrs. Garner, same question for you. When you see those charts, what comes to mind?
Well, first off, I think it's important when you talk about, pulling yourself up by your bootstraps. I would say that for the reality is for Black and Brown people, we don't have bootstraps to pick
Right.
to pick ourselves up with. So we're already operating at a deficit. And just understanding that when we talk about mental health, when we talk about the health disparities that are happening, it is on both sides of the state line. It's impacting our entire country. If you don't mind, I just kind of want to share a few statistics with you, just on the seriousness of mental health and not only our diet, but when we talk about the Maslow's chart, how that affects the lives of Black and Brown people. Just so you know, when we talk about mental health in Wyandotte County, including suicide, they include suicide as a 3rd largest health concern in 2022, and that was results from our community health assessment. As well as in Wyandotte County, suicide is the 3rd leading cause of death for youth ages 15 to 24. And we can relate or correlate that information back to your diet, how you are the things that you're exposed to in your environment. Another alarming statistic in Wyandotte County is overall hospital admissions due to suicidal indication are at 60.3% higher in Wyandotte County than overall any county in the state of Kansas. And
Wow.
so these are really concerning statistics and data that we are trying to, with declaring racism as a public health crisis, that we're really trying to address and really take away some of the systemic and structural racism that exist within our policies and procedures at Wyandotte County or in the unified government of Wyandotte County.
Wow, those statistics are mind-numbing, to say the least. I can't believe that the 3rd largest health concern is. So when you think about, the diabetes, the coronavirus, all these different things that we're highly familiar with, it is rattling to think that suicide is the 3rd largest health
Right.
concern.
Yeah.
It's very rattling, very rattling. We got a comment from YouTube from Andrew Boykin. He is the founder of the Restoration, restin2050.org, which is a nonprofit that seeks to address a lot of the issues that we're talking about. So I want you to check that out. His comment says, if nothing is done about it, we will be imitating art. It will be considered the Walking Dead.
Mm-hmm.
That's literally where we're at. Also, Miss Friday Hall, always appreciate you. She says she's sharing it with her networks. We appreciate that. Thank you very much. And so let's continue on with this conversation. Nicole, I want to ask you this. Why do you feel that mental health is such a big problem, specifically in Wyandotte County? What are you seeing?
Well, mental health is a big problem because of the systemic barriers and then racism that exist in the county, and it's not addressed. When we talk about mental health in Wyandotte County, we found that there are fewer less mental health clinicians per district in Wyandotte County than any other county in the state of Kansas, which means that if a person has mental health challenges, they don't even have access to mental health providers. And so if you don't have access to address issues, how can we dismantle that? How can we help residents with their mental health needs if they don't even have access to providers? And there's a shortage of mental health clinicians throughout the state, but
Mhm.
specifically in Wyandotte County there is a grave shortage. And we're talking for every 5 to 10 residents, or for every 1,000 residents there's one mental health clinician.
Yeah.
In the state of Wyandotte County we have in the county we have almost 160,000 residents that are crossing the state line going in and out of Missouri. And if you think about the mental health concerns of those residents not being able to address the mental health issues that they have, it's really alarming. It affects your overall health. And we're dying at disproportionately higher rates than any other ethnic group, not only in the county, but that's also in the country.
Yeah.
Um, and so it's definitely a huge concern.
Mm. Therapy. It's a big thing. It's a big topic. I was looking at a statistic from the American Psychological Association. It said that the average person needs 15 to 20 sessions, and that's just for 50% of the people that they see to actually gain any benefit from it. For my research, most insurance companies are only willing to pay 3 to 8 sessions, right? And so when
Yeah.
you talk about economically suppressed areas, they don't have the money for those additional sessions. And so my question for you, Mike, is what can we do at the state level to change that? Is there anything in the works, or are there any steps that we can take?
Okay. Okay. First, let me say this, Mr. Johnson, that what happened was uh, we had at one point the clinics and the things that were needed, and this was a long time ago, and this was around the country. But there was a president. I'm not going to say any names, and it was in the 70s that decided to get rid of all of the facilities that we had that provided excellent mental health care. Uh, and so I think that started to get us to the point where we are now. Now, what we're doing at the state level to address it is, I once sat on the Health and Mental Health Committee. Uh, I'm mad that I'm not on there. Well, I'm not mad, but I'm not happy either. But I still have connections there, so I utilize them as much as possible. I think that what we're doing at the state is recognizing that everybody, especially now, considering COVID, everybody has some type of post-traumatic stress disorder. There's always going to be a mental health issue that's going on, uh, considering the time and age that we are living in. Now, how do we combat that? I think that some things that we need to do are started by addressing the need to provide a unique set of skills and services to these individuals. We can't herd them, as I've mentioned to you before, Mr. Johnson. We can't herd them like cattle and say, "Oh, you have a mental health issue. Go over here. Go over here." Each individual is unique and has to be treated as such in order to find out exactly where the core of their mental health issues lie. So I think that is one thing that we are trying to combat here at the state level, is making sure that we put the needs of those with mental health issues at the forefront, just like we do anybody with any regular physical health ailments or issues. So I think that that's a start. And so once we do that, and we team up with our neighboring states, our Wyandotte counties in Kansas, and we team up with Mrs. Gardner, and Mrs. Garner, when we're able to do things that are bringing us together, that we can find out where the problem lies initially, so that we can not treat each individual alike. And then that way, I think that we can have things set up in place that we can further be able to help our people who are in mental health distress. A lot of it is because of them, because of the poverty issues as well. So I think that it is a gambit that is going to take all of us in order to fix it. We have to listen to those that are actually dealing with it. We can't just have all the answers or ideas. We have to go where the people are and reach them and ask them the questions that are needed to find out what it is that they actually need.
I wholeheartedly agree. Go ahead.
I just wanted to kind of touch a little bit on mental health. And then you asked the question, how does this impact, a residents and overall? When you think about mental health and you think about police brutality, when you think about blue, um, police officers, killing or harming Black and Hispanic men, a lot of it times it's just due to mental health
Yes.
and not understanding that a person is in crisis or a person is
Mhm.
having a mental health issue. And so we are quick because we're not educating our not only we're not educating our departments, specifically our police departments and even our EMTs on how to understand and how to recognize somebody who is in a mental health crisis. And so a lot of times we turn to violence as opposed to having a mental health clinician, ride along or help them, train them and help them to recognize when a person is in mental health or having a mental health crisis. The answer is not violence, but is to actually look at and seeing how you can help them and get services. And the same thing goes when we see people that are homeless. A lot of times it is due to mental health. And so to kind of summarize, the question about, how are we seeing mental health play out in Wyandotte County, in Kansas City? It's playing out in so many different areas, and the lack of not only resources but educating people, um, that is just detrimental to Black folks and to
Yeah.
Hispanics, and it's we have to stop it. We have to figure out a way to educate people on mental health issues and
Yeah.
how to really provide services.
Yeah.
I think another part of it is people actually understanding that it is systemic, right?
Mhm.
Because it's easy in this day and age to just say, well, we're here today, right? This is the greatest time on earth. It's 2023.
Right.
Technology is advancing. You
Right.
have access to all of these quote unquote resources. But what we don't do is look in the past. And I'm not talking about all the way back to slavery. We don't even have to go that far, right? Here in Kansas City, Missouri, there's a street called Truce, right? We all know about that. And so if you look on one side of the state line
It
of Truce,
shows. Yeah.
you see a completely different landscape than on the other side, right? And so when we think about J.C. Nichols, one of the biggest real estate developers in Kansas City, he literally had covenants when he sold homes to not
That's
sell them
right.
to Black people. And so what did that do? Well, that put us in a position where we had to purchase homes that weren't appreciating at the same rate as our white counterparts. During that same time frame before civil rights, we couldn't even buy life insurance at adequate amounts. And so
Right.
when their grandparents passed away, we got enough money to bury them. When their grandparents passed away, they had enough money to invest in the stock market, to purchase real estate in appreciating areas, to start businesses. And so when you look at the socioeconomic ramifications of that, it's
Mhm.
generational. It's
Mhm.
generational. And when you're living at or below the poverty line and you have simple things like, healthy food being a problem for you, secondary education, right? If your grades are good enough to go to college, but not good enough to get that scholarship, and your family doesn't have the financial resources to send you on, we
Yeah.
already know statistically you're more likely to
Definitely.
fall into an average job that keeps you locked into that bottom rung. And then when we
Mhm.
look at the tax revenue, so now you pull a bunch of people together with limited resources and low incomes. Well, the tax revenue in that area is low, which means that the schools won't have
Schools
the
as well.
funding that they need. The children don't get the education that they need. They don't have the same programs. And so if you go out to different areas in the community, you'll notice that they have, fishing, they have hunting, they have archery. And it's terrible because when you
Yeah.
think of how brilliant our Black and brown children are and how athletic and how easily they're able to step into different situations and excel, they're limited in what they can do. So it's basketball, football, or track. And if
Yeah.
you can't excel in one of those,
Yeah.
you're not able to go into those sports that actually give you more opportunities for scholarships with less competition. And so
Correct.
it's not just a, pull yourself up by your bootstraps today. We have to go back and look over time. And so Mrs. Garner, she has an initiative that she's working on right now. She has some listening sessions going on in Wyandotte County. Can you tell us a little bit about that and how it just relates to systemic racism?
Absolutely. And so, what we're doing, and a lot of this, we've been working on this initiative for a few years now, and it really kind of spearheaded from COVID and understanding the disparities that existed for Black and Brown people. And so, we are have an initiative where we're going to be taking it to our mayor, Mayor Garner, and to elected officials in declaring racism as a public health crisis. And instead of us just looking at all the data that we have, because the data is there, this is not anything new that we've been talking about. We've been talking about this for years now. Um, we are looking and having 11 listening sessions that are throughout the district or throughout Wyandotte County. And these listening sessions are designed to help us prioritize the most important issues to take before our elected officials. And so our plan is to not only educate, but to help advocate for funding, for programs and initiatives that specifically address systemic racism and how it relates to health. Our listening sessions are, we try to look at everything and remove all the barriers for our listening sessions. So we're offering culturally appropriate food, and we're offering transportation. So if you need a ride to get there, as well as childcare. And then lastly, we have mental health clinicians on site, because we recognize that when people have experienced trauma, when they have experienced systemic racism, it negatively impacts their mental health and how they're feeling. And so we don't want to re-traumatize our residents when they're talking about their experiences with racism. So we do have mental health clinicians on site. And like I mentioned, we are hosting these 11 sessions. We also have one that we're going to be doing online for disabled people that cannot get to us. And so out of our listening sessions, we're going to take all the data that we gather, and we're going to take the top 4 to 5 priorities to elected officials and to the mayor, to ask them to not only put resources behind the policies and programs that address racism, but also to help spearhead an initiative that will hopefully help, dismantle some of the systemic structures that have existed within the unified government and throughout the county.
I love it. And I want to commend you for the work that you're doing in that area.
Thank you.
And the CDC, about a year ago, they have the same push, is actually declaring racism as a mental health crisis or public health crisis. Um, Mike, in Kansas, the task force into reparations, right? And so I'm not looking to go deeply into that, but what I want to do is paint a picture that shows to the people who are watching that we're at a time that we were never at before, where these conversations are at the forefront. And so my question to you, Mike, is what can the average citizen do at the grassroots level to help push these initiatives forward?
Great question. I think that where we can start is one of the biggest things is having people that are advocating for mental health that have genuine stories themselves that they can tell. Because anytime there's something's organic, you get people to open up. A lot of people don't want to talk about it. At the Black Archives last year, I had an event for Mental Health Month, and in advocating for mental health, what we did was I opened up as the speaker and told some of my own situations. And I cannot tell you how quickly everybody's hand came up that wanted to speak next. Everybody in the room had a chance to speak. By the time we got through, everybody was enlightened, teary-eyed, hugging, and feeling good, because it was the first time that they had ever spoke about their own mental illnesses. And it just felt good to see that pressure off of their backs, and us being able to start our own process of becoming a team of advocators that can go out and simply ask those in our public sectors, what are your needs? How do you feel? Do you have any type of mental health issues? And to be able to have a setting, as Mrs. Garner spoke of, that is not where you feel as if though you are revisiting those things that were traumatic to you, but giving you a safe place with professional individuals around you in place that can help you with your needs and help you become a part of it. See, I think that it's important for any time that a person receives any type of mental health help, that they also become an advocate, because the more we have that are advocating, the more we are opening up this thing that Black and Brown people are always have been told to generationally not to speak about. So I think that that's where we can start, and that don't cost nothing.
Yeah. I mean, it's about removing the stigma. And so my
Right.
nonprofit, Elevating Men, it's all about mental health. We speak from a male perspective, but if you listen to our conversations, they're universal.
Very much
They're
so.
universal.
The and it was something that was stated earlier that when we were when Ms. Garner spoke about the police, I think that it is in our DNA, Black and Brown people's DNA, the trauma that and the history of trauma that have been caused by police. And so what happens is, regardless of who you are, you can be a police chief, a Black police chief uh, over your city's police department. A cop gets behind you, even one of your own cops, you still feel a certain way. It is in your DNA. And like you stated earlier, Mr. Johnson, we don't want to go back as far as to slavery, but there were things that were done in slavery where the women that were impregnated had to stand in front of their husbands or the fathers of their children, and the babies were cut from their stomachs and their wombs in front of the men, and then the babies' heads were crushed. Okay, so if that doesn't lie within your own DNA from seeing things like that, and I think that it can be passed on generationally, and that's how we got to the point where we are now. Because the police back then, that's where the word paddy wagon comes from. Because all they were doing was going around and picking up the slaves that had ran away or had either escaped. So I think that it is something that is within us, regardless of who you are. And the only way that we can get rid of something that is that systemically embedded in us is to, first of all, we have to deprogram in order to reprogram.
Yeah, I mean, and there has to be training. There
We
has to
have
be
to have
training
it.
around that.
Yeah.
We had a show around it was last year
Mm-hmm.
on Elevating Men, and we had a group of police officers. Now, understand this. One of the police officers, he was so afraid to be honest on camera that we only had audio for him. This is
Wow.
Wow.
real. And so during the conversation, one thing was brought up. It was, when you pull someone over, what is it that makes you feel that you need to go the extra step in searching their car? So you pulled them over, you ran their information, there's no warrants or anything, but all of a sudden you want them to get out of the car, you want to search their car. And he said, well, it could be anything. It could be that they're acting fidgety or they're not making eye contact or anything like that. And it was a learning moment for him because what he didn't
Mm-hmm.
understand is that as Black and brown people, listen, I could have just had a bad day coming home
Right.
from work,
Yeah.
and I got you pulling me over, right?
Yeah. This
Uh,
didn't get
it,
easier.
yeah, yeah. Or me looking directly at you could be seen as a sign of aggression. And he said in that moment that he had never heard that, he had never thought about that, and it gave him something to think about. And so I believe that training, when it
Yes.
comes to you being in a community that you're unfamiliar with, is key. Is key.
It's
It's
so key that the the police officers need psychological evaluations because they go through traumatizing events as well. But it points to being able to see where their head is at, and to see if they are able to continue working their beat and being effective and being
Mhm.
people that are working for the people, because that's who the police work for, is for us, and not treating us the way that we have been treated for generations. And I think that we can get away from that if we do take into consideration that we need to make sure that these police officers are capable of being in the right state of mind to go out and police and protect and serve.
And may I add to that about policing and doing mental health evaluations? That's pretty standard. But what ends up happening is that it's not a continual process.
Right. It needs to
So
be
there is
quarterly.
it needs to be quarterly because there's just so many things and people are impacted by what they watch on TV, the
Yes.
systemic issues that they're in. And so although, I'm a, if I'm a police officer that's been on the force for 10 or 15 years, my evaluation may look very, very different than it did when I first joined the police force.
Yes,
So
ma'am.
there needs to be the structure is and the systems are broken. So they definitely need to be reevaluated. And I kind of wanted to touch back on another point that AL mentioned about, the stigma that's on mental health as a community. And when I'm speaking specifically to black and brown communities, we have to start to normalize the fact that mental health is
Okay.
a disease, it's a
Mhm.
challenge just like anything else. And once we can start to normalize that and understand that there may need to be therapy, there need to be medication prescribed, that people will be more likely to speak up about their mental health issues and more likely to address them because
Mhm.
they're not stigmatized. And so I think that there has to be some normalizing of what mental health means
Yeah.
to you and how we look at people that have mental health issues that in some cases because they didn't have access to quality health care.
Mhm.
And in Wyandotte County it is something that when we talk about access to care, Black and brown people have the lowest are the lowest numbers of quality or access to health care. Those are untreated conditions that go on for years, and as a result you're seeing it play out in our communities, and that food deserts and people not getting food, and I mean all the systemic issues that we mentioned, you see those playing out, and it's based on lack of access
Right.
to health insurance,
Yeah.
and also not normalizing the fact that mental health is a disease or issue just like anything else, and it has
Yes.
to be addressed.
Yes.
So, well, here's the other thing with that. You guys have both been in sales. Mike, you sold insurance just like me. Nicole, I know you've got a background in sales. And what do they say? What is it, about 5 to 7 times that a person needs to be exposed to a concept before they're ready to buy? Is that correct?
Correct.
Okay,
That is
so
correct.
Yeah.
let's really think about it when it comes to mental health and the things that we're talking about right now. The conversation is fairly new in our community, and the
Mhm.
statistic that you shared early on in the show, Nicole, it's really got me shaking. Um,
Yeah.
the teenagers who are committing suicide, right? And so if we wait until people are adults to start having this conversation about mental health, a lot of times it's too far gone.
Yeah.
It's too deep by then. What can we do when it comes to the schools? Like I know there's, student counselor. Generally, they're helping them find their way or determine a path to college or, what do you want to be when you grow up? But what about the mental health of our children? How can we affect that and start early so that we don't have these issues in the future?
That's a great question. I think
Mhm.
again, it's about normalizing. Our schools and our teachers and our administrative staff, they're operating sometimes at a deficit, unfortunately, and not having all the resources that they need to educate our children. And there is a teacher shortage, as I'm sure both of you are aware of. And so I think, how do we start with our schools? Because the statistic did say that it's the third leading cause of youth ages 15 to 24. We can relate that back to a lot of the health disparities that exist not only in Wyandotte County but throughout the country. But I think it's about how can we arm our teachers on the signs and symptoms to recognize if they see a child or a student that has mental health, and providing them with that additional knowledge. So not only are we educating our police officers and our service workers, but we have to also educate and provide support to our teachers so that they
Mhm.
can recognize, or when they do recognize it, making a report. They're all mandated reporters, but sometimes there's just so many other things that are happening that they cannot add one more thing to their plate. But if we educate them, and they realize the importance of reporting that or getting with parents to help address it, I think that is a way that we can start to tackle it within our schools.
Nice.
I love that.
Nice.
I love that.
Nice.
Mr. Johnson, I know that you have another interview. I really, really want to keep you on. Do you have a few more minutes, or how's your
Yeah.
time looking?
No, no. I got a few more minutes.
Thank you. I appreciate that. Sticking with the children here, because I think that's important. Like, imagine a child who, doesn't have a father in the home, or they're raised by their grandparents. They've already felt that first level of trauma because the person that was supposed to love them the most, their parents, have neglected them in some shape, form, or
Mhm.
fashion. Generally they're in a lower economic state, and so when you think about our schools and bullying, like the things that they go through, you go to school with the wrong shoes on or the wrong outfit on, then you're getting bullied. And so we see these situations play out where there's violence in our schools in the inner city.
Yeah.
I mean, I hear about fights in the bathroom all the time.
Mhm.
It becomes a war zone essentially because you have all these brokenhearted children who have been
Yeah.
through traumatic situations, and you're putting them in this one place with no mental health um, tools.
Yeah.
And so, Mike, I know in your district we had a conversation, and you said it's both the richest and the poorest district. And so if we talk about the poor part of the district and the schools and what goes on there, I'd just like you to piggyback on what Nicole talked about, as far as what we can do from a training perspective for our
Yes.
teachers.
Mhm.
If there can be maybe a mental health professional on site at each school all the time, like what are some suggestions that you have?
Man, well, let me tell you, Brother Johnson. Right in front of me, I have a piece of legislation that I just filed, um, and it deals with mental health in the schools. And so, what I'm asking in this piece of legislation is that we have it set up to where our students, especially in secondary education, uh, and if they have any signs or symptoms or have been diagnosed with any signs or symptoms of any mental health or mental health concerns, that they should be allowed up to one day, um, if needed, uh, to have a absence. They should be able to have a day out of school, because you just said something that was very important, AL. What if they are being bullied and they have to go to school that next day? And what if this is an opportunity for them to finally speak with someone to express their concerns about what's happening to them at school? And what if it's someone that wants to go to school and God forbid, but they've been bullied and now they want to shoot the school up? But what if they could make a phone call and not go to school that day? And there's so many situations that we're dealing with that are problematic, that deal with mental health inside of our school systems, that we do have to have. And this bill also has it where we have to have a mental health specialist, some type of mental health specialist inside of each school as well, so that we can combat these situations that are happening every day with the bullying, with even the verbal bullying, or whatever the situation may be that we're concerned with. But I think that this type of legislation will help ease those problematic situations that are happening throughout our school districts.
I love that. What is the number for that legislation?
That is House Bill number 728.
House Bill 728. Thank you. I
Yes.
appreciate that. Now, this is the thing. Mr. Johnson. I know
Yes,
that
sir.
anybody who hears this conversation agrees wholeheartedly with everything that we're saying because they're living it, right? We're not talking
Yes,
about
sir.
anything that people don't know, they're not living in, they aren't
Right.
aware of. What do you see as far as engagement from the average person when it comes to town hall meetings, when it comes to conversations like this, when it comes to you saying, hey, we've got Bill 728 that we need you to get behind? Are people getting behind it? And if not, what can we do to increase engagement in our local government?
Love that. I think the one thing that we can do is based on grassroots again, and that's we have town halls. Let's have town halls where town halls are effective. If town halls are not effective where we are in our district, or what that particular bill may be focused on, or that agenda may be focused on, let's take us to the people. Okay, that's something that I do on a regular basis. I don't have to have a scheduled appointment to have an appointment. All I need to do is be in front of you. And we've been in sales before as well. And we know if we can get in front of 10, we can sit down with 3, we can sell 1. My attitude with that is, let's get out in front of 100 people, get a real concern from at least 30 of them, get help for 10 of them at a time. So let's go to where the people are, as opposed to just having things set up to where they need to come to us. Everybody, because of our poverty situations, can't make it, don't have the transportation to get to these facilities, don't have Wi-Fi to be able to stream this important information that we're giving. So I think that it's an opportunity for us to say, hey, we'll just meet you where you're at.
I love that.
I,
And
I love that too.
go
May I
ahead.
add
Go
to
ahead, Ms.
that conversation? I love hearing you say that, Representative Johnson. And here's the thing, and I'm just going to keep it real. When as a parent, and when we're thinking about parents that are trying to make sure they keep food on the table, lights on, gas in the car, all these, daily issues, daily challenges just to live and exist in this world.
Yes.
Sometimes the last thing you're thinking about is how can I be a better advocate, or how can I, understand and educate myself on local politics and getting involved. And so what I say is we have to empower people. I love hearing you say we have to go to where the people are. In our listening sessions, we're doing that exact thing. We're
Yes.
also equipping them with just really basic information on how to engage with your commissioner. Sometimes people just don't know.
Mhm.
And because they have so many other challenges and issues that they're dealing with and are faced with in their daily lives, it's like, I don't have time for that. I am trying to survive. And so when we empower people, help educate people, meet people where they are, go to the people instead of requiring them to come to us,
Right.
that is our responsibility, and how we are giving and putting the power back in their hands. And so
Yes.
I appreciate
Yes.
you saying that, because we have to go to the people. We can't
Mhm.
assume that people want to just be involved in their be involved in the local level, and these are the things that are impacting them
Yeah.
directly.
Yes.
Um, but we have to empower them and help
Yes.
educate them and go to where they are. And so I love to hear you say that, and it sounds like that's what you're doing, and so that's awesome.
Thank you so much. Thank you.
This reminds me of something, and I apologize, but I'm getting ready to go off on a little tangent here. I'm gonna go off on a little tangent, but
Uh-oh.
I'm gonna put up this picture, and I've used this several times, but it's an analogy that I love, and I believe that it's relevant to what we're talking about. And so, um,
Oh yeah. Oh
that's
yeah.
apple cider vinegar, and that's a bunch of dead gnats in it, right? And so, when you think about it, you see, you know, dozens of gnats in there, right? How is it that they continue to jump into their own demise, right? They saw their friends jump into it, they jumped in right after them, they suffered the same fate. The reason that that happens is because the scent is so
Mhm.
irresistible to them
Mhm.
that no matter what they saw, no matter what damage or destruction they saw someone else go through, they jump right into it, right?
Right.
And so when we listen to our music, when we look at the club scene and things like that, they make it so enticing that people almost can't resist becoming a part of that. And I feel that's one of the mistakes that we make when it comes to these types of initiatives, when it comes to government participation, even when it comes to church, right? People love preaching to the choir and keeping things within four walls, right?
Mhm.
But how can we make it more attractive? Like, how can we sweeten the pot so that we can get more people involved? What does that look like? So one thing you said, Mike, is going to the people and going where they are, right? Um, we need to engage the younger voter base. We
Always.
really do. Like I always see the older people, 50 and up, they're highly engaged. The
Mhm.
call paper, all
Mhm.
the information is there. They pick it up every week. But our younger demographic, I believe, gets left behind. I remember MTV had something called Rock the Vote, right?
Yeah.
Where that was their
Yeah.
attempt to get directly in front of the younger generation with those messages. What can we do? Bro, you're sharp, man. Like, I can see you making an appearance at one of the clubs on the weekend. Say, hey, I'm Representative Mike Johnson. These are some of our initiatives. Boom, boom, boom. Maybe 3 to 5 minutes, but something. Or
That's
social media is another thing.
that you
Yeah,
you hit it on
yeah.
the you hit the nail on the head. I've actually keeping it 100. I've sold insurance in a club before. I said, you love your family, don't you? While you're in here kicking it,
Hey,
you know.
hey,
So it
whatever
don't
it
matter.
takes.
Once again, it doesn't matter where you're at to be able to be effective and get things done. Um, so what I would say is that the same thing after we reach the people on a grassroots level and we're going to the people, then we need to have hubs. We need a MHH. We need mental health hubs set up where people can feel free to walk in and just get to be themselves and sit in a nice uh, quaint setting that seems inviting and engaging, and it allows a person to be themselves and talk about their issues that they have going on and feel good about it. And it's a place where they can come advocate after they've done that, and also receive the assistance that they need. Any resources that are readily available, we should have them on hand for all of our for all of our people. And that what I'm saying is when we do that, then we'll see the numbers changing. You know, it's we got to get it started. But the thing that we have to do when we start these things is everybody that doesn't want to see us be effective in advocating for mental health, get them out the way. Don't talk to them. Don't have meetings with them. Don't invite them to the meetings because they're not doing anything but being toxic and holding up the process of you all evolving and being better for those that have mental health issues. So I think that if we have hubs set up, things like that, it doesn't cost anything. The hub can be in the community center. It can be anywhere. So we don't even have to say that it's an issue as far as having a budget. The issue is just making sure that we have the right people engaged and making sure that they want to do this and they want to do it from their heart and do it with love.
We got to do the work. We got to do the work. I want to take a quick second and recognize a couple of people in the comment section. We appreciate your engagement. We appreciate the comments. Like and share this, because if this conversation stays within a small group of people like it always has, we really can't affect the change that we're trying to affect. I want to shout out to Mr. Melvin Brown. He said, I can appreciate this topic and discussion. I see so much of this in the schools. He's actually the community engagement liaison for Northeast High School. And so Melvin Brown, thank you for tuning in. And if you're still tuning in, he's on LinkedIn. If you could just share a comment or two about what you see in the schools as it relates to mental health and the children there, I'd greatly appreciate that. Dinner and Dialogue, he has a few comments here, and so I'm going to have to give this some context. But this is him imagining, and I do agree with him here. What he says is, I just read about this new partnership that will kick off in 2024 between the state of Missouri, Wyandotte County, the University of Missouri, and the University of Kansas, Elevating Men, the Men's Wellness Collective. Just for context, the Men's Wellness Collective is a group of therapists that are connected to Elevating Men. And the Restoration, which is another 501c3. They've described a bi-state 20-year study. Both universities each received a $50 million grant towards this study. I'm excited. Have any of you heard of it? And so he was being a little facetious there, but He has a very good point, because at the end of the day, for us to move the needle with anything, a lot of times there has to be the scientific data and research behind it. And so when you go to present a bill, Mike, they want to know what stats and what figures are behind that. And so from a grant perspective, is there anything that's out there? I'm connected to a lot of nonprofit organizations that have the same mission of tackling poor mental health. What resources are out there for us so that we can get the statistics we need, so that we can present them to you, you can take them to the State House, and we can get the ball rolling? What does that look like?
First of all, it doesn't look like it should, first of all. Second of all, a lot of the help and the resources that are available are through non-for-profit organizations or private entities that already have established funding being allocated to them on a annual and fiscal basis. So what we have to do is we need to make sure that we're contacting all of these agencies, that we have them on speed dial, that we know, because here's the thing, and a lot of times people don't understand this. Even though we are given access to all of the information and the resources, we don't always get them in a timely manner or fashion. So I think it's very important for us to be able to correspond with one another, stay linked in with one another, so that we make sure that all of the valuable information and the resources that are available are at our exposure. And then as far as from on a state level, what we need to do is team up with people like yourselves and other individuals that are on here with us this evening as well. And we need to draft a piece of legislation that actually deals with these problematic situations, that we can all push together and have those same people that are willing to be supportive, boots on the ground, actually doing the work, that don't mind it and that love doing the work behind us. And we can push this type of piece of legislation. We can start it now. This is something else that I like to do. I like to have conversations where we sit down, be it over lunch or be it over Zoom, regardless. But we come up with things that are pieces of legislation that actually deal with the people, and the people actually get to be a part of it. There's nothing that is of more fulfillment on a state level than seeing a piece of legislation drafted and drawn up, and it was made up of the actual people.
I love that. I love that. I'm actually working on a, community roundtable in April, and so I'd like to invite both of you to be on the panel for that because that's exactly what we're trying to do. Mrs. Garner,
Yes.
you have the listening sessions going on. You're hearing directly from the people, and so that's the first step that Representative Johnson actually talked about. Can you speak about the next steps? What are you guys going to do with that information, and what are your hopes?
Sure. And so the next step is to take all the priorities that community has indicated to us that are important and take those directly to our elected officials, so our commissioners and to the mayor. And subsequently, our hope is that they will, address those initiatives, in the form of programming, in the form of policies, and then also putting their money where their mouth is. And so a lot of states or a lot of municipalities have declared racism as a public health crisis, but sometimes it just kind of has been left there. But we really want to take it a step further. So not only are we engaging community, having them help us prioritize, but now let's take these initiatives to the people that have the power, which is our elected commissioners and our mayor, and ask them to fund policies. And we're also looking at an all-in health policy component within the declaration, which means that they would have to take a deep dive into all of the policies that impact residents that are applied within the UG, and if they have any sort of racist angle, or if they're systemic, or if they create more barriers than help, they have to take a look at those policies and
Mhm.
completely rewrite them so that they are all in health and that they are beneficial to everyone and not just certain people. I want to also just jump back quickly, and I'm getting a little bit off topic, but I think it's important because I think the question was, how do we get community involved? What are some things when we talk about researchers and grants? One of the things, and I didn't mention this earlier, but we are also paying every single listener that comes to our participant that comes to our listening sessions. We have a history, or there's been a history of taking and stealing intellectual property.
Mhm.
Researchers come into our Black and Brown communities. They gather all this information. They bring all these people together, and then they leave
Yeah.
with no follow up
Yeah.
on what's going to happen with the data that we are sharing, our lived experiences. And so we did not want to do that. So we received a grant so that we can also compensate people for their time. And so, not that I'm saying we need to pay people to help with mental health, but what I'm saying is, if there are resources out there, and if we are, soliciting and getting information for the people that are impacted by these systemic issues, there has to be a way to compensate them for not only their time but their intellectual property and their
Yes.
shared stories. And
Yes.
so, that happens a lot. And so we did not want to continue to with that cycle. And I think it's important when you are talking to funders and researchers that want to come in, and they're saying they have this grant and they want to do research, we have to demand some of those things from them because there are resources there, but if we don't ask, it won't
Right.
happen. And
Yeah.
so I think that's just, I would be remiss if I did not say and mention that.
Thank you for sharing that. I appreciate that.
Most
And it's really
definitely.
like that old saying my grandma used to say, like the squeaky wheel gets the grease,
Greece. Mhm.
right? Um,
Absolutely.
we're not loud enough. We aren't loud enough. And so I want to say that to each one of our listeners, just like when it came to, George Floyd and,
Right.
protests against police brutality, et cetera. We have to get loud, and not just when it's on a national scale or it's a huge story. It's these systemic issues that affect our everyday lives that we're quiet about. And, we just try to pull ourselves up our bootstraps. We wake up every day, we wash our face, we try to go to work, and we just try to sludge through it, when at the end of the day, if we would make noise during the quiet times,
Mhm.
Mm.
that's where we can
Mhm.
really affect change.
Most
We got a
definitely.
comment here from Dinner and Dialogue. He said that's because they know exactly how to actionize that information that we talk about. Exactly,
Most
exactly.
definitely.
Mike, I could tell that you had a comment there. What did you want to say?
Oh no, that I just totally agree with everything that you both have just stated because I mean it's just so important that we organize, strategize, and continue to do both of those things and uh, and put it to action and not always give out the playbook, and so I think that that's important what Mrs. Garner stated that they're paying these speakers. So that they are vested in it, and it keeps everything to me. You get the best of the best when you do this, and I think it's a form of giving back, and it also shows the importance of what it is that we're talking about. So we do need to scream these things, especially when everything is quiet. And also to you, Mr. A.L. Johnson, it's brothers like you, brothers and sisters out there with the same cause, that we can control our own media now. You know, you can reach as many people with Channel 4, Channel 5. It's just the engagement process. So I think that it starts here, and we're doing that type of work now.
Thank you.
And
I
speak,
appreciate that.
Mm-hmm.
Yes,
I was
ma'am.
just going to say, speaking of schools, there's so many young, future leaders. And so how can we empower them? Because, if you're a teenager, you're much more likely to tune in or to engage with someone who is your age or a little older.
Mm-hmm.
And so we again, it's about how do we meet people where they're at, but how also engaging our young leaders that want to get involved, engaging, just our everyday hardworking people, and empowering them
Yes.
to advocate. I mean, that's really what it takes. One thing I speak about or talk about. These listening sessions, we're waiting on a hero, we're waiting on somebody to save us. It's not happening. Your
Mm-hmm.
Wakanda is not happening. you
Mm-hmm.
you are you are that person. You are the hero. And so how do we empower people that are just hard everyday working people to not only be advocates but to rally their community members and to dismantling some of these systemic issues that
Mm-hmm.
exist. It's going to take all of us. We have to have a village
Takes a
approach.
village.
um
Yes.
we can't wait on one person or the government to help us with these problems because they've existed for hundreds of years and it
Yes.
hasn't happened. So we
Yes.
have to stop. We have
Yes.
to start empowering people right
Mhm.
now, and taking that grassroots approach that you
Yes.
that you mentioned.
I think that
No,
we. Go ahead,
go
Mr.
ahead.
Johnson. I'm sorry.
No, I was just going to say, I believe that's where a lot of the disengagement comes from, because when you say that these problems are systemic and they've been here for 100 years plus, it seems hopeless, right? Because year after year, we're electing these new officials. They make promises. They say we're going to do this, we're going to do that. We don't see any change, and we stay in the same spot. And so I believe that a lot of people are just disconnected from the process because they don't believe that it works.
Right.
That,
Every system, everything that we do should have a 365 wraparound service. Everything that we do, we shouldn't elect people and then not stay in touch with them. Everything should be a wraparound service. You make promises to get in office. Well, accountability is big. So I think that we need to look there, and we need to see where they're at. It's just not about being down here in Jeff City. You have to be in your community when you're at home. You have to be uh, obtainable. You have to be attainable. You have to be with the people, a part of the people. You just can't sit around and say, "Hey, I got all the answers for you." You have to ask them what it is that they need to even come up with any type of solution. So I think that a lot of times when we come up with ideas for the people and we don't involve the people, then you're just like a CEO sitting at the top of a high rise, and at the bottom of that high rise is a warehouse, and he's never been in it, but yet he's trying to tell everybody how it should be ran and the best way to be effective in running it.
it's changing rapidly in Kansas City, Missouri, just even with the legislative redistricting. Uh,
Mm-hmm.
I don't think people see the problem with that. Like when you take, this is our district, and then all of a sudden, this is our district, and
Yeah.
it becomes obvious that they are trying to include certain parts of the
Mm-hmm.
county, and exclude other parts of it. And so we
Mm-hmm.
really do have to, if we want change, we have to be a part of that process. We got to be
Right.
a part of that process.
And
I appreciate having you guys on here. I just wanted to say that again really
Absolutely.
quickly, because again, you guys could be doing absolutely anything. I know that you both are busy, but it really shows how much you care about the community and you care about change. And so I want to commend both of you for that. We are close to wrapping up the show, so I want to make sure that you get any final thoughts out. If there's any way that you need support, if there's any events coming up, I want to have an opportunity to put that information out there. And so, ladies first, as always, Ms. Garner, you have the
Thank
floor.
you. Sure. Well, we have several more listening sessions that are upcoming. If you're interested in joining on our listening sessions. And we are really focusing on our Wyandotte County residents. However, please reach out to us. You can RSVP at wycohetf.org/RSVP. And so if you are listening and you live in Wyandotte County, we highly encourage you to attend one of the listening sessions and to RSVP, come and have good food. We have, again, we provide transportation. We are also compensating you for your time. And then lastly, we have clinicians on site to address any needs that you may have. And so I hope to see you all there. And AL, thank you so much for having me on. I think this was a great conversation. And Representative Johnson, you're doing really good work. And so I appreciate your conversation and as well.
Thank you. Thank you so much.
Awesome. I'm going to leave that on the screen there for a second. Visit wycohetf.org/RSVP so that you can be a part of the listening sessions and get your voice heard. Because again, as she said earlier in the show, they're going to take your concerns, your thoughts, your ideas, and they're going to bring that up to the mayor. They're going to bring that up to the mayor. And so we're always talking about, we want things to change. We want to see a difference. This is your opportunity to make a difference. Don't just sit there and hear this information and don't take action on it. wycohetf.org/RSVP. Go there now and reserve your seat. Mr. Johnson, what information do you have for us, sir?
Well, first of all, I'd like to commend Mrs. Garner on the work that she's doing as a public servant as well. And to say that I too have taken down the wycohetf.org /RSVP because I want to attend as well. And so I do thank you for that information. Also, you can reach me at my house email, michael.johnson@house.mo.gov. And you can also reach me at mjkcmo23@gmail.com as well. I think that this is a very, very important topic. I want to make sure that we come back around, Mr. AL and Ms. Nicole, and continue this conversation, because I think that we have opportunities for not only pieces of legislation that we can use on the Missouri side, but as well as the Kansas side. And absolutely, I would like to also share, I'm going to send Ms. Garner the stats, the statistics that we have here as far as those that are impoverished and dealing with mental health issues as well. So I'll get all those stats over to her as well. And I just appreciate you for having me, Mr. Johnson.
This is what it's all about. That's what I want to hear. The connection,
That's it.
To have you two on here is one thing. For you all to connect afterwards and see how you can work together, that's what we actually need. And so I appreciate you saying that. I appreciate
remember we all just agreed that you can't just throw someone something and then just forget about them, So I think that even with us, that we have to make sure that we follow back up and do a full wraparound service, a 365, to make sure that not only are we okay mentally, but we're doing the work that we set out to do.
So for those of you that are tuning in, be looking out. I'm planning something in April, and so I'm going to need all of your support. We're going to have a community roundtable. I'm hoping that these two great people will be able to be a part of that, and lend their voices. We have to do better. We have to do better. And if we really want change for the next generation, it starts with us. It starts with us being active. It starts with us being engaged. Put down the remote sometimes, right? And get involved in your local community. It's extremely important. Check out one of those listening sessions. I'm excited to see what that's about. And hopefully, it creates some of the change that's intended. I appreciate having both of you. For all of you that are tuning in, one last request. Share this with your network. Again, when these conversations stay between a small group of people, they aren't as effective as they could be. And there were a lot of nuggets that were dropped in this conversation that I believe we can pick up and take action and run with. And so I appreciate all of your time. Watch the page, because I'll be back with another conversation sooner than later. If the two of you could stay on for just a second afterwards, I'd like to debrief with both of you. Thank you all for tuning in, and have a great evening. See you next time.